The reason that these insights are so important is that, as you all know, consumer engagement is hard. Well, what makes it so hard? First off, there's a dynamically changing environment. When the ACA happened, we thought there was a dynamically changing environment back then. That has nothing on now. Between the pandemic, the political climate, the vaccine, star weighting measures changing, so much is happening that trying to find that North Star of engagement with all of the environment changing around you is hard. Two is healthcare is complex, it's confusing. And it changes, those changes make it even more confusing, right? What's covered, what's your deductible, is your provider in-network or out-of-network? Then driving sustained engagement is hard. I used to work for companies like General Mills and Procter & Gamble. I like to say getting you to eat when you weren't hungry and buy things you didn't need. And so when I came to healthcare in 2005, I was excited to use all those methodologies to drive good behaviors instead of evil. But it turns out when I get you to get a colorectal screening, you don't get endorphins like you do when you buy a flat screen TV or you get Zappos shoes. So how do we get consumers to stay engaged? Next up is information overload. We all know there's thousands of television channels we're getting marketed to on the sides of buses and at the gas pump. Consumers are so overloaded with messages. How do we break through and get them to hear? And then finally, the consumers themselves have changed. Consumers no longer compare their healthcare experiences to other experiences within healthcare. They're comparing us to their favorite brands, and so the bar is high. Does anybody here know how many ways that Starbucks claims they can personalize your beverage? Anybody? According to Forbes and HuffPost, Starbucks claims to be able to personalize your beverage 18,000 different ways. So when it comes to personalization, the bar is super high. Am I getting an echo, or is it just me? Everybody, can you hear me okay? Great. So how do you engage consumers? We call this the engagement equation. So everything that consumers see, feel, hear, and touch, all of what I call above the waterline, all the tactics you use, the letter, the email, the contact center interaction, in order to optimize all of that, to make it the most effective for a consumer possible, there's all this enabling infrastructure under the waterline that needs to happen. And that's a lot of the vendor partners that we saw here this week, right? That's things like C360, being able to orchestrate your multi-channel correctly so that it's seamless for consumer. It's cleaning up your data and finding data integrity. So all of those things come together to make the above the waterline effective. And then finally, population-specific insights. It's not enough anymore just to personalize your communications and your interactions by commercial, Medicare, individual, Medicaid. Now we really have to dig in and understand consumers, find out what's on their mind. And by doing so, we can finally deliver that optimized experience that we're all working towards.